Well, good evening, everyone, and welcome to our weekly press briefing here on the COVID-19. Before I start, just I'd like to say it's hard to believe, but Election Day has come and gone here in the city of Worcester and the country. Between the mail-in votes, early voting, and in-person voting, the residents of the city of Worcester cast over 70,000 ballots in the election. I want to thank everyone who voted for taking part in the most great American tradition. This was the highest vote in a presidential election in the city of Worcester since the 1976 election of Jimmy Carter. I want to recognize the city clerk, Nico Vangelli, and his whole entire team. For weeks ahead, the primary election in September and the general election in November, dozens of city employees and volunteers, a number of volunteers, the Parks Department, the police officers, the poll workers, and the wardens worked 80 and 90 hours a week to make sure that the votes were cast, counted safely and transparently and correctly. Regarding COVID-19, as of yesterday, the new state numbers were released, and so we have 1,629 new confirmed cases statewide, 17,455 estimated active cases, 9,836 deaths among confirmed cases. The city of Worcester, the numbers aren't going in the right direction. I would say the numbers are bad, and the manager is going to be more detailed on the numbers, but we've had a highest daily rate and a highest weekly rate since probably May sometime. So, and we're trending in the wrong direction. So this is serious, and that's why I keep on telling people to wear their masks, practice good hygiene, and socially distance where possible. The city manager's idea with the roses we put out here were important. I think he sent an important message. We don't want to see those roses increase, the deaths increase here in the city of Worcester. And I read Dr. Hirsch's comments in the paper regarding we're about 2 weeks behind Europe in the COVID-19, and their numbers are jumping pretty high. So so it's important. Everybody who dies represents someone who has a family member. We're going into the holidays, so I'm asking people to do their best and follow the regulations. And speaking of regulations, Governor Baker released a new set of public health regulations designed to curb the spread of COVID-19. We're seeing numbers again increase in the state and in the city. Under the updated order, and people probably already know this, but masks will be required for anyone in a public space, indoor or outdoor, regardless of the ability to maintain social distancing. Governor Baker announced an overnight stay at home advisory, resembling a curfew from 10 p.m. to 5 a.m. to allow activities such as commuting to or from work, running essential errands, and taking a walk. Indoor gatherings at private residences will be reduced from 25 to 10, and outdoor events will be reduced from 50 to 25. Restaurants will be required to cease in-person dining by 9:30 p.m., although takeout and delivery options will still be available. Liquor stores and other establishments will be required to cease alcohol sales at 9:30 p.m., and several other categories of recreation and entertainment businesses will also be required to close at 9:30 p.m. These new rules and regulations will take effect tomorrow, November 6th at midnight. We urge every person in the business to comply with the rules, and they're going to be enforced by the city officials. Again, as you see, we have a slowly increased surge here in the numbers here in the city of Worcester, and UMass is going to be offering testing again next week at three times, Monday and Tuesday, from 11 a.m. to 4 p.m. at the Mercantile Center. And you just enter off right down here from the courtyard off on Commercial Street. And again, on Thursday at 11:04, it's either going to be at the Mercantile Center or the Community Health Link. So that will be determined and posted over the next few days. Again, Thanksgiving is coming up. It's coming up quickly. The state has offered guidance on Thanksgiving. If you host or attend a holiday gathering this year, please be vigilant and adhere to proper protocols. If possible, keep gatherings small and limit to those with whom you live and those whom you have regular contact with. Be aware of the state travel guidelines. You can go to mass.gov for more information on travel orders. When hosting those who do not live with you, make sure you wear a mask, wash your hands often with soap and water, maintain social distance, be mindful of anyone in your gathering at a higher risk of severe illness from COVID. When gathering indoors, try to ventilate where possible by opening doors and windows. Likewise, if you're visiting someone for the holidays, I encourage you to get tested after the visit to ensure you have not contacted the virus to help not to spread the disease. There's a couple more announcements. Hot food delivery. I mentioned this a few times at the Worcester Together group here in conjunction with the City of Worcester. We provide funding for the local restaurants to feed families who are quarantined with COVID-19. The city has contributed $100,000 to this program. So if you're interested in participating as a restaurant or as a family or friend, please call the Family Resource Center at 508-796-1411. Mental health. Since the start of this pandemic, we have seen a concern that social isolation and the loss of routine would lead to mental health issues in our children, our families, and ourselves. I believe if we're not already going into a mental health crisis, if we're not there already, and so this is so important that people get the mental health from their doctors. Go get your services. Don't be shy. And please get the services that you need from your local doctor. 2 years ago, I started with the Mayor's Mental Health Task Force with Dr. Castile and mental health providers from across the city. This work has been augmented and expanded under the umbrella of the Worcester Together coordination. Kim Salmon from Hanover Insurance is one of the co-chairs of this committee. I just want to thank her for being here today. But I could see it when you have the school committee meetings, when the parents call in, the anguish, the stress they're under, whether it's balancing work life, balancing their kids, trying to get their kids on the Zoom, and so it's very stressful. And we see an uptick in the hospitals with children being serviced at the hospitals with a number of different disorders and suicide attempts, etc. So that's why I asked Kim Salmon, who co-chairs the committee on mental health, to talk for a few minutes today. Thank you, Kim.
Thank you, Mayor. Thank you for letting me come and talk about this really important subject. So I am not a clinician, not even close, but I'm a member of this community. And the mental health of our community is so critical right now. Who would have thought 8 months ago that we would still be standing here, shut down, masked, isolated from the people that we love, doing the things that are important to us? Who would have thought? But we are. We're here. We've just come off of an election with still no clear results. Anxiety, fear, stress. It's overwhelming. It's overwhelming for all of us. We're all affected by it. And the stigma has always been to not acknowledge it, to not talk about it, to not recognize it, but kind of keep it on the side. We can't do that anymore because we're in a position where it is affecting all of us. Our children are affected by this. Our parents, our seniors, our homeless community, everyone is truly affected by what's happening around us. Our mental health is critical. The mayor has charged us with coming together as a community and trying to identify resources for all. And we really have taken that charge seriously. This is important. One is you have to reach out for help. You are not alone. We are all in this together. I have a 9-year-old daughter who is doing this whole remote learning experience. And we've got to see, she's like a different person today. She's having temper tantrums and just falling apart towards the, second part of her school day. She has a great support system, but this is hard. This is affecting her so hard to not be able to be around her friends. I have parents who are reaching out and saying, my kids are struggling through this. I don't know what to do. And as parents, to see that, to not have those solutions, it's killing us. So we need to rely on one another. There are community resources available all around us, and we need to pick up the phone, we need to reach out, and we need to access the services that are available. We're all there for one another. Call a friend. Call someone you haven't spoken to in a long time. Call a parent, another parent at school. Call anyone and just reach out. Keep the connections going. Keep talking to one another. Reach out. Reach out to the community-based organizations. We have incredible ones. The Boys and Girls Club, the YMCAs, Girls Inc., You Inc. All of those organizations are trying to create a safety net for our community to help us through our mental health. Just remember, we are all in this together. You are not alone. So take advantage of the resources that are out there. We are going to take on that charge that the mayor set us with, and we are going to try to come up with some resources and responses. We're looking at doing community circles, social distance through these changing weathers and the changing temperatures. How do we try to safely bring people together with the new guidelines to connect? Because I think it's important to still make those connections. The holidays are going to be difficult, but we will get through it. If we give up one holiday with our family, and I have a big family, so I know how hard it is. But if we give up this holiday and we safely distance and stay home, it is going to make it so that next holiday is even bigger and better. But let's make this sacrifice today. Let's call on each other. Let's Zoom for the holidays and share those moments. My sister will make the great dinner. I'll have chicken nuggets for mine, but I'm still going to enjoy it. But I'm going to call on them and reach out to them. I want you guys to do the same. This is important. Our mental health is important. Let's remove the stigma of it. We are all challenged by this. And we will come back with some solutions for our children, our youth, and we will for you, for all of you. So thank you, and keep the faith. We are all in this together. Thanks.
As of today, we have 7,380 overall confirmed positive cases here in the city of Worcester. That's an increase of 266 from our last week's report. That's 30 more than last week's high number at 236. Today alone, we had 84 new cases. That's the single highest daily increase since the first wave of this virus. On May 22nd, we recorded 86 new cases that day. The increase, the second wave, is clearly hitting our neighboring communities as well. Shrewsbury saw 30 more cases since last week, bringing their total of 531. Shrewsbury, Holden, 18 new cases, bringing their total to 206. Grafton, 14 new cases, bringing their total 157. 20 new cases in Leicester, bringing their number to 233, and 19 new cases in Millbury, bringing their number to 342. In terms of clusters and trends that we're seeing, it really is, in a number of areas across the map. We have seen new cases in long-term care facilities, group gatherings, businesses, and residents. Small and large family gatherings continue to be of concern, and where we see a good portion is what we call community spread that can't be traced back to a particular location where the exposure took place. Just a few things to illustrate these family gatherings being a major driver. Between October 29th and November 4th, 183 total cases. We had 20 households accounted for 45 cases, or 25% of the cases that happened during that six-day period came from 20 households. And again, it just reinforces this notion that people are getting together as families, getting together as family units, and are quickly spreading this amongst themselves. Today's 84 cases, just this highest day that we've seen since May, 9 households accounted for 30 cases. Or another way to say it is 36% of today's cases came from just 9 households here in the city of Worcester. Our hospital numbers are not looking good. They're reflecting the increase in cases that we've seen over the last few days. We have an increase of 19 inpatient COVID positive individuals, 54 hospitalizations between the UMass and the St. Vincent systems. Likewise, our ICU patients are up by 5 to a total of 14 ICU patients. COVID deaths increased by 3 since last week to 391 between the two health systems. And again, the troubling increase in our health workers, with another 22 health workers testing positive for the coronavirus, bringing to 525 the number of health workers since the outbreak of the pandemic. Our colleges and universities, we have a total cumulative 137 cases with 23 active cases and 11 new student cases this week from our colleges and universities. Assumption has ended their lockdown, which went into place last week, and we have not seen major new cases on the Assumption campus, which is great. We do continue to see young people across the board accounting for a large portion of the new cases. 110 new cases this week were 40 and under. So we talked about 200 plus new cases this week, and nearly half of them came from under 40 years of age. I don't want to restate what the mayor talked about, but it is worth just reinforcing the notion. I know Kim mentioned this. We are getting into the holiday season. We know Thanksgiving is coming up. We remind people about the 10 people and less guidelines around gatherings, and we know households and family gatherings are a significant source of the spread. And so as we get into this Thanksgiving season, we know people's instincts and traditions are to gather together as a family. That is great. That is wonderful. Except this year, we really need to have people keep those gatherings 10 and under, and really look to not having family who is outside your immediate nuclear family in that one household gathering. And if people are going to do that, we urge them to take advantage of the testing opportunities that are taking place every week. There are free testing opportunities. If you are going to travel to a family member's home for Thanksgiving, or you're going to host family members, get yourself tested. Get the folks who are coming to that Thanksgiving celebration tested. Know what your status is, so that if somebody does have COVID, you're not spreading it to your loved ones. That's not what you want to have for your Thanksgiving experience. And likewise, the week after Thanksgiving, as people come back, we're urging people to take advantage of that free testing and make sure that you have not inadvertently been exposed to the virus, and bringing that back to your workplace, bringing that back to your home. We want to also just acknowledge the great work of the ambassadors team that we've had with the help of the state funds. Just this last week, they distributed more than 16,000 masks at multiple locations throughout the city, 2,500 plus disinfectant wipes, and distributed more than 3,100 flyers in Spanish, Vietnamese, and Chinese. They also did business-based signs, and they particularly focused on Spanish and Portuguese speaking businesses. Here in the city, we have one firefighter who's currently quarantined. We have 4 Worcester police officers who've tested positive, mostly in their outside setting, and 1 police officer quarantined. We continue doing our inspections, proactively going out, making sure folks, as we go into the new protocols this weekend, which require businesses to stop serving alcohol after 9:30 and have folks leave the restaurant at 9:30. They can still do takeout, they can still do delivery, but you cannot do indoor dining after 9:30 p.m. And we want to make sure proactively we're letting all our businesses know about these new guidelines that have been put forth by the state and making sure that folks are adhering to them. And so enforcement teams have been doing education up until this weekend when it goes into effect, and will be going out doing enforcement as necessary after the guidelines go into effect. I want to just reinforce something we've talked a lot about, what some people have coined as the twindemic, this idea of the flu season and the COVID second wave happening at the same time, and the possibilities of folks being exposed. And actually, we are hearing of cases, not necessarily in Worcester yet, but in the country, where people are being diagnosed at the same time with the flu and COVID. And the CDC is suggesting that there are additional complications that can come if you do have both the flu and COVID at the same time. The symptoms can be more severe, they can last longer, and certainly can be more deadly. So we don't have a COVID vaccine now, but we do have a flu vaccine. We urge people to go out. It's not too late. We're just going into the prime flu season to get that flu shot. Reduce your chances of getting the flu. And if you do get COVID, reduce the chances of you having more severe symptoms and more severe outcomes having both the flu and COVID at the same time. It's one way that you can protect yourself and you can protect the entire community. So really avoid the double whammy that can come from getting both of these illnesses at the same time as we go into the second wave and we go into the heart of the flu season. I want to just remind folks about the library tutoring program that we launched at the beginning of the school year. It's a great online service, free of charge. Anyone in Worcester, and quite frankly anyone beyond the city of Worcester, if you have a Worcester Public Library card, you can get homework help. We know a lot of parents are stressed and struggling, trying to make sure they support their children's online learning. We know sometimes parents struggle to give their kids the kind of homework help that they need, particularly in some of the different subjects, whether it be physics or algebra. We have live tutors in multiple languages are available free of charge to support any students. They could be charter school students, they could be homeschooled students, they could be diocesan school students or Worcester Public School students. Help Now is the name of the organization. It's available 7 days a week from 2 in the afternoon until 11 p.m. in the evening. Just since we started this, we've had 1,400 young people take advantage of the program. The most requested subjects, which are probably subjects the mayor and I probably would have used this tutoring service, algebra and physics. 97% of the users said that they were satisfied with the sessions. Again, go to the Worcester Public Library. It's myWPL.org. Sign up for a library card and take advantage of this great free resource available to any young person who needs a little help with their homework. With that, I'll turn it over to Dr. Hirsch.
Thank you, Mr. Manager, and thank you, Mayor Petty, and thank you, Kim Salmon, for really, I think, bringing to light a very important health problem that we've been seeing more and more. I talked today to the city manager and the mayor about a discussion that I had with one of the head nurses at UMass on the pediatric unit, and at one point last week, almost half the inpatients were children that had either been abused, that had tried to commit suicide, or that had an eating disorder or cutting disorder. And that's a very different kind of demographic than any of us want to see. I know there's a lot of pressure on all the families to ride through this period where the kids are not being adequately socialized. I think that we're going to have to come up with new solutions. The Zoom method, I think, tires kids out after a certain while, as you heard Kim reference, and we're going to put our heads together with the pediatricians in the area, with the family medicine docs in the area, to see what we can do as physicians to reach out. I think one of the main things I would emphasize is that you don't necessarily, if you're noticing that your child is having mental health issues, have to reach a psychiatrist. They're backed up for months. But your primary care doc has a very good handle on primary psych 101 care, where they can hear you out, see your child. And I would urge you, don't let the stigma that Ms. Salmon referenced keep you away from the doctor. We're all in this together, and we're all suffering together, unfortunately. The weekly call-in that I have with the health centers and the community health centers and the medical centers was as depressing as everything else that you've heard probably today. The Family Health Center has been doing a magnificent job taking care of its population of folks, and they're actually in negotiations to take on some medical services for the new planned extension homeless shelter, overflow homeless shelter that will reappear at Ascension Church. But their positivity rate in the patients that they've been testing has gone up from 8% to 15%, so just about double in a week. And similarly for the Edward M. Kennedy Center, their positivity rate went up from 21 to 32% in a week. So the community spread that the city manager referenced, where we really don't know where it's starting, where it's stopping, is out there. And I think that's the explanation that the medical center's infectious disease docs, that's Dr. Ellison for UMass and Dr. Abraham for St. Vincent's, both said that they're seeing many more health workers coming in without symptoms, but as they get tested, they have been shown to have the virus. So we used to be seeing about one of these workers a week, and now we're seeing 4 to 5 a day. So the virus is amongst us, and it is very, very tough to beat. And if you don't follow the 3 W's, like the mayor says every week, I think you leave yourself at tremendous risk. It's protection for you. It's definitely a protection for those around you. And certainly when you come home from your place of work or school, really doing that all day, you can rest a little bit easier that you're not going to be bringing this virus back home. But obviously, I think the community has gotten tired. They're frustrated, as we all are, that this is dragging on so long. We have more miles to go, unfortunately, until we get that vaccination program going in the year 2021. And I think that until we have that herd immunity from vaccination, we're going to continue to see the numbers go in a wrong direction. We can flatten the curve with tighter regulations and tighter adherence to the 3 W's, and we did it before, and I know we can do it again. So I wish we, again, could go back in time and think about how we all, put our shoulders together and were able to mitigate a very, very bad outbreak in the spring. It could have been a lot worse. We had a lot of forethought that went into reducing the spread and reducing the damage and reducing the overwhelming of healthcare workers by having the DCU Center, by having the Beaumont long-term care facility, by utilizing the state system of hotels for the homeless. I think we were able to get through it, but a lot of it came from the hard work of the families to shelter in place, to minimize the amount of excursions they did, to go to curbside shopping, and to not wander through big box stores and other places where they will be exposing themselves. When I spoke to this head nurse today in the pediatric unit, the other sad fact is that the nurses themselves on that unit, and I think this is representative of all the med centers around, are really distressed at the kind of pain, the kind of anguish that they're seeing families go through. They themselves are getting emergency assistance for psychiatric help and moral and sociologic support. This is the kind of stuff that will be made a lot worse if, as the city manager said, we face a twindemic come December. A recent paper that Dr. Ellison quoted for us in our call was from Great Britain, where they showed that people with the combination of COVID and flu that were coming to ICUs and needing the ventilator had double the mortality of those that only had COVID. So this is a serious threat, and I hope people can eke out a little bit more intestinal fortitude and strength of will to help us get through this. And we'll do everything we can in the city to help with this, but it really will come from the community. I think you can't take the public out of public health, and right now that's what we're appealing to, is be mindful about your choices for the holidays, do the 3 W's, get your flu shot, and if you're having mental health problems, as Kim Salmon suggested, reach out. Don't bottle it in. Don't try to solve it on your own. There are medical professionals to help you, and sometimes it's just a matter of just admitting that there's a problem, whether it's to your friends, to your neighbors, on Zoom, and help will arrive. So, last thing I'll say is I tweeted about this earlier today. Believe it or not, this is the day in 1955 that Marty McFly went back to when he went back to the future. And I've been thinking about that all day, because I wish I had a DeLorean that would transport us to next Thanksgiving and we could think about all the stuff we went through. That day will come. We just don't have the DeLorean here. But we have the will of the city to be together. We are the heart of the Commonwealth, and we'll get through this together. Rough road ahead, but I think we can do it.
Not sure who this question specifically is for, but I know Mayor Petty talked about the testing, the Stop the Spread testing next week. There's 3 of them. Has there been any consideration, like today's was from noon to 4, spreading those hours out, making them more convenient to people? If they had it and they had to work, 12 to 4 might be difficult for them to get to.
It's something that the manager's brought up a few times, and I've talked to UMass about, but I think the idea is try to spread out in different parts of the neighborhoods, but that's something we can take under advisement, and I think some good ideas. The problem is that we have with testing is they use the generators, they use the internet, so they have to be, if you go over there now and see how over to the test site right now, you see how challenging it is, and all the equipment they have there. So that's the biggest challenge.
I guess this may be a question for Ed. You talked, and you've been talking in recent weeks about the breakdown of the portion of cases attributed to a certain number of families in the interest of advising people about their gatherings. But just my math, which could be very wrong, would say that, okay, you said it was 36 cases among 9 families. When you do that math, aren't they technically under the limit as far as the gathering?
Yeah, it's not so much about being a violation.
Yeah.
It's about not following the protocols. You could gather with 2 or 3 people, and if you're not wearing the mask and observing the social distancing and washing the hands, you can spread it. So it's not so much that we're seeing huge gatherings or gatherings that are beyond the limit. It's about not keeping the protocols in place when you're socializing with people who aren't a part of your immediate family.
So having someone over, making sure that they're 6 feet apart when they're sitting in the backyard, that kind of thing.
That's right, and you're wearing your mask. And now with the governor's mask mandate, you're supposed to be wearing the mask at all times. Even if you're, going for a walk in the neighborhood, you're supposed to have that mask on. And, we know it's tough. It can be challenging. Sometimes people, get hot or whatever. But that really is an effective strategy in trying to prevent that spread.
Thanks, Ed.
Thanks.
Question for the city manager again. Sorry, Ed. How does the city go about kind of enforcing those policies of making sure people are wearing masks, making sure bars or restaurants are empty by 10 o'clock or closing at 9:30?
So we have the inspectional, interdepartmental inspectional teams. We have folks from inspectional services, from the police department, from the health department, who go out, and they go out every weekend, many nights during the week. Sometimes they're going out responding to complaints that we've heard where people are not following the protocols, and sometimes they go and just do random compliance checks, trying to look at different types of businesses. So they'll be in restaurants, they'll be in box stores, they'll be in other settings, trying to make sure everybody's following the protocols. We always do try to do education before a new guideline goes into place, and that's really what we've been trying to do this week with the governor's new orders coming out, reminding people what it means to stop that alcohol at 9:30, no in restaurant dining after 9:30. You can still do the delivery, you can still do the takeout, but that really is kind of a new wrinkle, and we wanted to get it out before we do the enforcement piece.
For Dr. Hirsch, this might be anecdotal evidence, but it just feels like more people are wearing masks now than in May when the new high number kind of reached. Is there any evidence to why that number is kind of spiking up again when it seems like more people are wearing masks now than maybe they were in May?
It's a really good question. There's a lot of controversy in the medical literature and amongst the various infectious diseases societies as to whether the virus has become more transmissible. I think my way of putting it together, and I'm not alone in this is certainly something that I have generated after speaking to a lot of different experts, is I think that the virus spreads much more readily amongst the 20 to 50-year-olds because they don't get as symptomatic. So they're walking around not as aware that they are spreaders. Back in the spring, we were not testing enough to know that the 20 to 50-year-olds were getting this virus. We were only testing symptomatic people, and we were testing the elderly in the long-term care facilities and some of the homeless because they were such vulnerable populations. But I think that the presence of the virus in this 20 to 50-year-old population was there then too. And I think that now that we are seeing much more testing done thanks to the efforts of Dr. Castile and UMass and H Project Worcester for the Stop the Spread and the Health Equity Task Force, we're realizing just how prevalent it is amongst that group. So I'm not sure it's more transmissible. I think it's always been there. It's just we're seeing it. So I don't want to sound like, testing causes more cases. It's not a causal thing. It's just that it's been there before our eyes, but we haven't really used our technology to root it out. Now that we see that, with the contact tracing we're doing, we get the kind of information that the city manager shared about family spread, and I think this is going to be vitally important moving forward. And we're continuing to ask for as much help as we can with contact tracing, because that right now is the substitute for not having a vaccine.
Dr. Hirsch, you had mentioned earlier, you had talked about how generally we were running 2 weeks behind Europe in this regard, in this wave that we're seeing. And now if you look at what's happening in Europe, besides, you see the cases, but the reaction to that is taking us right back to the empty streets and lockdowns of, Paris, France closed all their restaurants, Germany restaurants and retail. When you say 2 weeks, should people be starting to kind of wrap their heads around even more drastic things? It seems like these measures have been kind of around the margins. We've got this overnight shutdown, and the masks that we've all been wearing anyways.
Well, I think we're trying to respond to this spike in an incrementalist way. We all will feel terrible if we go to a very advanced drop back step, because I think it's just devastating for the economy. But I've already gotten into so much trouble this week projecting about the future. Like Yogi Berra said, it's hard to project about the future. I'm not completely unaware of the issue, but I think that for now we have to try to go all in on each step as we go. I don't think the city manager said last week nothing is off the table, and we may be facing some of those European solutions, even if it's for a short block of time, so we can try to dial it down for a little while till the vaccine comes out.